Michael woke up one morning with a strange heaviness in his hand. It wasn't pain. It was numbness so vivid that he dropped his coffee mug. He walked to the mirror and couldn't move his arm. Fear flooded in. His body, it seemed, no longer followed his mind's instructions. Michael insisted it wasn't in his head, but every doctor he saw came back with normal test results, brain scans, reflex tests, blood work, all clear. Yet his symptoms were real. His arm remained unmoving. His voice grew hoarse, as though his throat had forgotten how to speak. He couldn't walk steadily. Something was terribly wrong, but medicine had no answer. What Michael was actually experiencing is called conversion disorder, also known as functional neurological symptom disorder. This disorder isn't rare fiction or a cry for attention. It is a real, brain-based condition in which overwhelming stress or emotional trauma is turned into physical symptoms the person cannot control. It's not malingering. It's the brain converting emotional pain into bodily expression. Michael had lost his job suddenly and felt invisible in his relationships. His mind couldn't process the grief. Instead, his brain delivered the grief in muscle weakness, in loss of speech, in paralysis. He wasn't faking this. He couldn't wake his arm, even if he tried. What is conversion disorder? Conversion disorder appears as one or more neurological symptoms, like paralysis, tremors, seizures, difficulty speaking, blindness, or numbness, that cannot be explained by medical tests. It occurs because mental distress disrupts brain function that controls movement or sensation. To meet this diagnostic criteria, the DSM-5 require one or more symptoms affecting voluntary motor or sensory function, clinical findings that the symptoms are incompatible with known neurological conditions, exclusion of other medical or psychiatric causes, significant distress or impairment in daily. Michael fit this exactly. His tests were negative, yet his arm remained paralyzed. The symptoms paused his life in its tracks. For Michael, hearing that the symptoms were real and treatable felt like a lifeline. Physicians explained that early diagnosis paired with appropriate therapy can lead to recovery. Treatment starts with education, understanding that the symptoms are involuntary and not imaginary. Building a trusting therapeutic relationship is key. Then comes psychotherapy, especially cognitive behavioral therapy, to address underlying stress and trauma. Physical and occupational therapy help regain function and prevent disability, how it happens and why it matters. Conversion disorder is most often triggered by severe stress, emotional conflict, or trauma. Historically, the term conversion came from psychoanalytic ideas. Pain the mind can't bear gets converted into physical symptoms. Today, experts recognize a mix of psychological and neurological changes in how the brain processes stress and emotion. Brain imaging shows changes involving areas like the amygdala and sensory motor pathways under emotional distress. Conversion disorder is diagnosed in roughly 4 to 12 people per 100,000 annually and affects young adults, more often women than men. This disorder can present as paralysis, tremors, seizures, difficulty speaking, blindness, or numbness that cannot be explained by medical tests. For many, symptoms are frightening and isolating, but understanding the brain's role opens a path forward. Recovery can be swift when symptoms are recent, especially in children. For others, it may take months, but many individuals return to full function. Prompt diagnosis, acceptance, and treatment are critical. Diagnosis is the first step to healing. For Michael, hearing that the symptoms were real and treatable felt like a lifeline. Treatment starts with education, understanding that the symptoms are involuntary and not imaginary. Then comes psychotherapy, especially cognitive behavioral therapy, to address underlying stress and trauma. Physical and occupational therapy help regain function and prevent disability. Recovery can be swift when symptoms are recent, especially in children. For others, it may take months, but many individuals return to full function. How you can help someone like Michael. 1. Believe their symptoms are real. Don't dismiss them as in the mind. The symptoms are physical and involuntary. 1. Encourage medical evaluation. Rule out neurological causes with compassionate care. 1. Promote treatment. Therapy and rehabilitation can be life-changing. 1. Support with patience. Healing unfolds at its own pace. Michael began CBT, slowly explored his unspoken grief, and also worked with a physical therapist to gently retrain his arm. Over several weeks, strength returned and words came back. He learned that his body had tried to hold his pain in its own way, and with support, he learned to feel it, not hide it. Conversion disorder isn't a reflection of weakness. It's an expression of unseen pain that your brain felt it had to convey. But with help and care, that message finds its voice, and healing begins. If Michael's story gave you insight, please share this video. Awareness gives that soft voice a chance to be heard, and delivers real hope to people whose bodies are speaking a pain they cannot name. If you found this video helpful, be sure to give it a like. Share it with someone who might benefit. Be sure to check out our other mental health education videos.